going on and why. So the essence of health. We're going to look at some of the issues that might be behind this, and we don't want to just talk about a problem. I'd much rather talk about solutions to problems. Even better, preventing problems in the first place. But for those of you who are new to it, ESSENCE is an acronym that stands for education, stress management, so that's the mind-body area of mindfulness. We'll spend a bit of time on that today. Spirituality. So where do we find meaning and purpose in life? Importance of physical exercise, as we're becoming an increasingly sedentary community. The importance of healthy nutrition. Connectedness, so that's relationship, community, a sense of belonging, and the importance of a healthy environment. So we'll look at each of these things, and mind you, I'm just going to pick out a few things here and there just to illustrate some important points. So, just to say a little bit as well about this is what we're trying to teach our new generation of doctors at Monash University, where I've been working since 1989. Teaching in the medical faculty there. And we teach our medical students about this. So they all go through what's called the Health Enhancement Program, which is a mindfulness-based healthy lifestyle program. And we say, well, we're not going to teach you about this just theoretically. We're going to be teaching you about it in such a way that you will learn to apply this to yourself. And what we found was that by the end of the program, 90% of the students said, I'm applying these strategies to myself. I'm making healthy lifestyle change. I'm practicing mindfulness. It's helping with my mental health and well-being. And what we did, we measured their depression, anxiety, hostility, all sorts of their quality of life. We measured a whole bunch of things. And what we found was that by the end of the program, everything we could measure about their mental health and well-being significantly improved. That's thankful. The only thing was, as well, is that when we measured them prior to the program, it was in a very low stress period of semester. When we measured them after the program, it was immediately prior to their mid-year exams. We should have seen declines on every aspect of mental health because there have been literally hundreds and hundreds of studies that have shown that's exactly what happens to university students, particularly medical students, but we found the opposite of that. But we certainly hope that these students will look after their own mental health and well-being, because I can assure you a doctor that's not travelling well mentally and emotionally doesn't care for patients in the same way, because it's much harder, the burnout and so on has an effect on patient care. But the other factor is as well, is it makes a lot more errors. So we certainly want our doctors to look after themselves well, but we want them to understand that these are very important things to speak to patients about. So anyway, so we're certainly trying to teach our doctors about this these days.